We're recording. All right, it is 1 o'clock, and so we will get started. Welcome to today's webinar, Libraries as Hubs for Citizen Science, partnering with academic libraries to improve the health of communities. My name is April Wright, and I am one of the outreach librarians with Region 1 of the network of the National Library of Medicine, the NNLM. Our guest presenters today are Dr. Stacy Stanifer, Assistant Professor in the University of Kentucky College of Nursing, and King Simpson, Director of the Logan County Public Library in Russellville, Kentucky. Before I turn things over to our presenters, a few housekeeping items. This webinar is being recorded, so it will be available on the NNLM YouTube channel in the next couple of weeks. And we are happy to offer MLACEs for this class, and we will share the link with you at the end. And captioning is available, and the captioning link is in the chat. If you just click on it and click on continue, you should be able to get the captioning there. And our presenters will answer questions at the end, so please put your questions and comments in the chat and send it to everyone. Okay, sorry, slide is not advancing as I had hoped. All right, well, I'm going to tell you a bit about NNLM, and I'm going to try to reshare. In the meantime, the NNLM is part of the National Library of Medicine, which is part of the National Institutes of Health. Try this again. I am very sorry. I'm having a little technical difficulties here. Here we go. All right, so the NIH, the National Institutes of Health, is the nation's leading medical research agency. The National Library of Medicine is an institute of the NIH. It is the world's largest biomedical library, which maintains and makes available a vast print collection and produces electronic information resources like Medline Plus and PubMed. NNLM is the network of the National Library of Medicine and is an outreach program of the National Library of Medicine. The NNLM is comprised of 7 regions, each of which houses a regional medical library. The mission of NNLM is to advance the progress of medicine and improve public health by providing all U.S. health professionals with equal access to biomedical information and improving the public's access to information to enable them to make informed decisions about their health. And we are in Region 1, which is based at the University of Maryland, Baltimore Health Sciences and Human Services Library, and serves these states: Delaware, Maryland, Washington, D.C., Virginia, West Virginia, North Carolina, Pennsylvania, New Jersey, and Kentucky, where our presenters are hailing from today. And what the NNLM does, we offer free webinars and classes. We have access to a network of libraries and other organizations, and we offer funding for health information, digital equity, and data services projects. Now, about our presenters, please join me in welcoming our guest presenters, Dr. Stacy Stanifer and King Simpson. King Simpson, MSLS, serves as the director of the Logan County Public Library, located in Russellville, Kentucky, and site principal investigator for the Radon on the Radar. As site PI, Mr. Simpson leads the community academic team in Logan County to support public health initiatives and achieve social justice in his rural community. Stacy Stanifer is an assistant professor in the University of Kentucky College of Nursing and serves as a project manager and co-investigator for Radon on the Radar. As a nurse scientist, Dr. Stanifer's research focuses on cancer prevention by reducing exposure to radon and tobacco. As project manager, Dr. Stanifer oversees all aspects of the study and works closely with site PIs to coordinate public health efforts in the respective communities. And with that, I will turn it over to our presenters.
Thank you, April. You all can hear me, right?
Yes,
okay.
We can.
Great. Okay. Thanks for that kind introduction. King and I really appreciate the opportunity to share with you all our experience of partnering to promote lung cancer risk reduction in Kentucky. Now, to begin, I would like to disclose that this project that we're discussing is supported by the National Institute of Environmental Health Sciences, and the content we will review does not necessarily represent the official views of NIEHS. For today's presentation, we will describe for you how public libraries and academia can partner to support public health efforts and serve as hubs for citizen science to facilitate health equity and achieve social justice. And we hope that by the end of this program, you will be able to define citizen science in a way that you could describe it to someone else. You can discuss with others how public library and community academic partnerships can improve health for everyone in a community. And lastly, apply some, if not all, of the community engaged research principles to design your own library lending program that meets the community's needs and is reflective of community norms and promotes health for all. Before we get much further, I'd like to share a bit with you about our respective organizations. So King is the director of the Logan County Public Library, and it is located in Logan County, Kentucky. And this is a county that is in southwest Kentucky and is largely rural. The library has 3 branches and 13 full-time employees and operates on an annual budget of $1.5 million. The University of Kentucky College of Nursing is located in Lexington, Kentucky, which is in central Kentucky. And within the college is a multidisciplinary research, outreach, and practice collaborative called Breathe. So our mission at Breathe is primarily focused on promoting lung health for all, and we do this through research, outreach, empowerment, advocacy, policy development, and access to health services. And the reality is that our team at Breathe could not do the work and the research that we do to promote healthy environments and achieve health equity without our community partners. The CDC defines community engaged research as the process of working collaboratively with groups of people affiliated by geographic proximity, special interest, or similar situations with respect to issues affecting their well-being. And a fundamental premise of community engaged research is that community members know their community better than anyone. They know what the concerns are, what the people value, the activities going on, and who the movers and shakers within that community are. And over the years, our team has developed trusting relationships with organizations across the state that draw upon the strengths of the communities and the research team to create social change and address local health concerns. It is through community engaged research that our team, in partnership with others, has improved lung health for many Kentuckians. It is important, though, to acknowledge that the idea of community engaged research grew out of the recognition that traditional research approaches, while appropriate for answering many research questions, have often failed to solve complex health disparities and perhaps even left communities with distrust in the research community, because outsiders with no connection to that community have come in, collected data, interpreted findings, and then disseminated that information in peer-reviewed academic journals without actually going back to the community and sharing the findings with community members. We also must acknowledge that health issues exist within the context of people's lives, which can vary from person to person and community to community. As you can see here in the table that was adapted from the Duke Center for Community Research, community engaged research actively involves the community in all aspects of the research project. And in doing so, the research is taking place under real-world conditions, which increases the applicability of findings. In addition, by involving community in all aspects, including the analysis, interpretation, and dissemination of findings, we can build trust within those communities, which is important, right? Because the next time the community has concerns, they will feel comfortable reaching back out to you for help. So what are the benefits of academia engaging with the community? When we are trying to solve complex problems or create change, working with the community can lead to innovation. They know their community better than we do. For example, I live in Lexington, which is a 3-hour drive away from King. I could not identify a single mover or shaker in the Logan County community without King's help. I could never speak to you about what it is that people in Logan County value without input from our community partners and our citizen scientists. So by working together, we can leverage each other's resources to address the community concerns and minimize disparities. And because the community is engaged throughout the research process, findings can be applied directly to developing interventions that are sensitive and specific for the particular community. So the U.S. Surgeon General points out that creating healthy environments for all people will require active involvement in grassroots efforts, and we must keep in mind how the community in which we live shapes our health and well-being. The NIH has established 9 principles of community engagement that include guidance for the academic researcher interested in community engaged research. This really goes without saying, but partnership is characterized by mutual cooperation, respect, and responsibility. And when engaging the community with the goal of improving health, researchers must recognize and respect the diversity of the communities, socially, economically, politically, and be flexible to meet the community's changing needs. We have a responsibility to be good stewards of science and committed to fostering lasting change. So while the Breathe team has worked for over 20 years to build relationships and partner with community organizations across the state of Kentucky to achieve health equity, it has only recently begun to engage the public in citizen science. For those of you unfamiliar with the term citizen science, it is a form of community engaged research and is a research method that engages the public in the scientific process, where the public actually becomes a part of our research team by taking on aspects of the research process, including things like data collection, analyzing, interpreting results, and community-based planning. One of the scientific premises is that when the community residents participate in research, the residents are more motivated to take action and more likely to take ownership of the work. Opportunities for citizen science are growing all across the U.S. and are increasingly being used to accelerate environmental science, as is the case with the project we'll be discussing today. So an environmental hazard that is prime for citizen science is the study of radon. Radon is a naturally occurring radioactive gas and comes from the natural decay of uranium found in rocks and soil, and is found in varying amounts all throughout the U.S. The gas is responsible for approximately 21,000 lung cancer cases annually, making it the second leading cause of lung cancer in the U.S. Homes are a primary source of radon exposure as the gas easily enters through cracks and holes and becomes trapped and begins to accumulate. Because you cannot see, taste, or smell the radioactive gas, in 2005, the U.S. Surgeon General encouraged all Americans to test their home for radon and fix their home if their radon level is greater than or equal to 4.0 picocuries per liter. When high levels of radon are found, steps can be taken to reduce levels in the home. Systems can be installed by professionals that essentially suck the air out from beneath the home, preventing it from being pulled in. These systems are highly effective and can reduce radon levels in a home by up to 99%. While the EPA suggests that the cost of radon mitigation is comparable to other home repairs, the cost of these systems can range anywhere from $800 to $2,500, which for many is a barrier. Additionally, very few states offer any sort of financial assistance for low-income homeowners, and even fewer offer protections for those who rent. An additional barrier to mitigation is that many living in rural areas lack access to qualified professionals to install these systems. So in Kentucky, we have a lung cancer problem, and for many years, we have led the nation in incidence and mortality from the disease. Much of that has to do with the smoking prevalence, as nearly a quarter of adults currently report smoking. However, according to the EPA, approximately 93% of Kentucky counties have moderate to high radon risk potential. And this is concerning because a lot of our population is then at risk for radon exposure in the home. In addition, co-exposure to tobacco and radon increases the risk of developing lung cancer nearly tenfold. When taken into consideration, Kentucky's moderate to high radon potential and high smoking rates create the perfect storm for the overrepresentation of lung cancer. Yet little progress has been made to increase home radon testing in Kentucky. A recent analysis of 28 years worth of data found that annually only approximately 13 out of every 10,000 homes in Kentucky test for radon, and counties with a high prevalence of smoking had lower rates of home radon testing. We also found disparities in who is testing in Kentucky. Counties with higher income, higher education, higher home value, younger age, and higher home ownership had higher rates of testing. So while we have a lung cancer problem in Kentucky, the disease remains highly preventable by reducing exposure to tobacco and radon. For this project, we've established numerous community partners ranging from the library to hospitals to those in the affordable housing industry and community and technical college systems, and have recruited 60 citizen scientists from 4 rural counties to join our research team and help us develop innovative solutions to lung cancer risk reduction. Today, we'll focus most of our presentation on our partnership with the public libraries in these 4 rural counties.
Thank you so much, Stacy. So our research project, and when I say that, I truly mean our research project. So the University of Kentucky College of Nursing received the funding grant from that, which is tremendous. But really all of the folks who've got involved have really taken ownership to this project, and we'll talk a lot more about that as we go. But our project is called Radon on the Radar. Radar in this instance stands for Residents Acting to Detect and Alleviate Radon. So some of the things we're working to do is increase awareness of radon and its health impacts, as well as to ensure equitable access to testing equipment in these communities. We're utilizing citizen scientists as partners in each of the communities to not only test and gather data, but also to assist in awareness campaigns. We're increasing access to affordable mitigation of area homes. And all of this is with a goal to reduce the negative health impacts of radon exposure. So this project has 5 aims. Aims 1 and 2 focus on our citizen scientists who are recruited and trained to test their homes for radon periodically using a variety of testing means, and they conduct this research over time, which gives us the best possible data. Next, we have aims 3 and 4. Those include the pilot and full launch phases of the library loan program, and those will be the focus of today's presentation. And then finally, aim 5 concerns the creation of a radon coalition in each one of these communities to increase the likelihood of a sustainable radon awareness campaign beyond the life of the radar project. Okay, so here you see that in the middle is the state of Kentucky, and that's our radon risk potential map for the state based off of the current data. And then we've extracted the 4 counties that are part of this study. we have Christian, Logan, Pulaski, and Rowan counties. So the two counties you see in Western Kentucky are geologically similar, and they also have extremely high radon potential. So those, especially the yellow, brown, and red colors you see, are indicative of higher radon risk potential in those locations. So then you see on the other side, Pulaski and Rowan, located in different regions of the state. They're also geologically similar to each other and have much lower radon potential. So the high and low radon study counties were matched on population size and median income. And then, of course, we made sure they were located in different areas of the state. And those were also matched on observed range of current home radon testing prevalence. So you'll see in Christian County, less than 1% of the homes there have been tested. In Pulaski, the high end of our study counties is 9.8% of homes had been tested prior to the study. None of those results are what we want. We want higher testing in all those locations. So Stacy mentioned this is a community engaged project, and that recognizes that the partners in the community are necessary to improve and change health in those areas. So initially when this grant was written, it was going to consist, the team members were going to consist of the citizen scientists that were going to be recruited, the University of Kentucky's investigators and staff, as well as 3 area health education centers, or AHECs. So the plan was for each one of those AHECs to assign a site principal investigator and a site project coordinator who would help carry out all the aspects of the project within their own counties. In fact, they worked with UK investigators early on with the AHECs to help conceptualize the study and develop the approach and the methods that would be used to make sure that they had the input and buy-in from the locals that they needed, because they realized that would be critical to the success of the project. However, just about the time the grant funding was being awarded, COVID emerged and began to quickly rise. As we all remember, unfortunately, that meant those in the healthcare industry were, of course, overwhelmed in rapid order. So one of the AHEC partners, the one in Western Kentucky, which was going to provide a site PI and project coordinator for both Christian and Logan counties, had to unfortunately withdraw from the study. So initially we looked for another health-minded organization, but they were all in the same boat as far as dealing with COVID and just being unable to have the capability to handle the project at that time. So the advisory board got back together, came up with another plan, and was able to secure the area development district to cover Christian County and provide a site PI and coordinator there. And a little bit unique with my library here in Logan County, we were going to be involved in some of the later aims with the library loan program. However, we went ahead and stepped up to the plate and helped out with some of the, part of my desk just fell off, with some of the later parts of the study. We also helped with some of those earlier parts as well. So you'll hear a little bit more about that later. So you see a list of our community partners in the graphic on the right. We have those who are joining the Radar Advisory Board, our citizen scientists, our citizens who are just checking out the kits at the library to test their homes, and then those who will join the citizen scientist-led radon coalitions. Some of those individuals are a part of more than of one of those activities. So one of the things we've really learned over the course of this project is that our academic institutions who are working on these research projects, and then the public libraries who are actively looking for ways to add value to their communities, are great natural partners because they each have different strengths and competencies that they bring to bear on these issues. So some of the things we know about our academic partners: they're experts in their field, so they have the expertise and the knowledge base that often these librarians don't possess or would be difficult for them to replicate on their own. So they're able to bring that to bear on these projects. Also, they often have funding and resources available, such as with this grant for this particular project, and they're actively looking for partners to help them with this community engaged research. From the public librarian's perspective, of course, we're already an established entity in these communities. The academic team is not having to come in and set up some sort of base. They already have us here to rely on. We have our own facilities and our staff. We have low barriers to access. So public libraries traditionally try to operate in a way that is very welcoming to the community. And probably one of the biggest things is we are a trusted community voice. So as Stacy referenced earlier, oftentimes they can be viewed, especially in a smaller rural community, as sort of the outsiders from those traditional research roles that people here have a hard time connecting with them and vice versa. However, we're already in the community. We work here, we live here, and people know us, and we have that relationship already built in. So when we come to them and talk to them about something like this, they're more likely to respond positively. And then, of course, the thing you can probably anticipate, the libraries are already experts in sharing resources and information within the communities. And we already share far more than books. So libraries in my area, I can just think of a few things. They already share Wi-Fi hotspots, power tools, laptops, fishing poles. So you can go to the library for a lot more than books, and adding in radon detector kits is not a big stretch for us. So when we were designing the library lending program, our library, the Logan County Public Library, did really take on sort of an informal leadership role early on, because we were in the project in those initial stages before the other libraries got involved. We were able to provide a lot of our understanding about the inside workings of the library and provide suggestions for best practices. So in designing the library loan detector kits, we played a big part in that, but we also, then after the initial stages, we brought in all the library directors from all 4 of these libraries and heard from them and got their experience on the project and got some feedback from them. So we worked together during that planning process to establish guidelines for checkout procedures, documentation of how we would track our records, marketing, gathering statistics on checkouts, and then brainstorming logistical concerns. So we learned that each one of these libraries was, we try to keep things as consistent as possible across locations, but we also recognized the unique natures of the communities and the library systems themselves. So after this process, we had an idea about what we wanted the radon detector kits to look like. And then our academic partners were able to send 25 of those to each location to be distributed as they saw fit. So here are the contents of the kits for each library. Of course, the main component is the Airthings Corinthium radon detector. You see that there. I tell people, if you hadn't had the opportunity to see one of these in person, its dimensions are similar to that of a smartphone, though it's a little bit thicker than that. It runs on these 3 supplied AAA batteries, which come in the kit. I've had one of these setting up in my office and running continuously for about 2 years now, and it's on the same set of batteries. So they're very energy efficient. They last a long time. So unless the batteries get lost or not returned in the kit, that's a really low replacement cost there. The case, that black thing they're laying on, is the case. And it's just an Amazon Basics case. It was one we determined would fit all the contents well. It has a zipper, so it keeps everything nice and secure. And they've done a really good job of protecting the materials during transport. In the bottom left-hand corner there, you see the instruction cards. And those are laminated to make them easy to clean when they come back and to keep them from getting damaged. But it has information on how and where to test in your home for the best results, how to understand the readings once the device starts showing you those, and then, of course, information about joining the optional research study. There's also a link to an instructional video for those who prefer that format that's available within those cards. So we knew that one of the most important things we were going to do is the training of our library staff, especially the frontline workers. We realized that was going to be really critical to the success of the project. We know that those people who interact with the public every day play an outsized role in the success of what we do. Not only do we want them to feel comfortable and confident in answering questions when they're asked, but we also know that they're a great source of word of mouth marketing, that they're likely to talk to people. A number of the librarians here in Logan County initially checked out the kids and wanted to go home and test, and just obviously to figure out their own numbers, but also so they'd be comfortable with them, so they can now tell people, hey, I tested my home, it's easy to do, and they have some firsthand knowledge, which is really great as far as encouraging those folks to use those. For the way we did our training sessions, since they were in sites all over the state, we did conduct virtual training. We offered it live and on multiple occasions. One of those sessions was recorded for those who missed the live session or wanted to review it at a later point. We also have now been going long enough that we've hired staff in, so that just become part of our onboarding. As we get them up to speed with what we do here at the library, we can show them that recorded training video so that they have the same information the other staff have. Then for reference, we have a one-page FAQ sheet that our academic team worked with us to develop and distribute among the sites. So they have that available there at the desk. And we also have a digital form here, I know, at our library, where somebody can pull that up from anywhere and answer some basic questions if they're having, if it's not something they already know off the top of their head. So of course, a very important part of what we were going to do was our marketing of the program. So the academic team, again, recognized and respected the diversity of each community, and they wanted to become knowledgeable about each community. So they really worked with the site partners and the libraries and the citizen scientists to figure out what social networks were important in the community, what the culture of the community was, its demographics, and its norms and values, so that they could most effectively market this program. So, our main goal was, with all this marketing, is tell the public, you can go to the library and at no cost, you can check out this kit and test your home for radon, know your levels, it's easy, and there's no cost to you. So you'll see a variety of strategies we'll show you in just a moment. Some of them are very consistent from each county to the next. Some of them are very specific to the county, and these were all suggestions made by folks there in those local areas. So these are some that were all similar across the locations. So you see, we all had a page added to the library website telling some good information about the program. Of course, social media posts, a flyer that could be distributed. Here on the upper right, you see that's a retractable banner. So each location received 2 of those. So I know here in Logan County, we keep one in the library and sort of move it around to keep things fresh. And then we have one that circulates throughout the community. So this month is November, so it's National Lung Cancer Awareness Month. So our health department is displaying that and giving out some materials for us. So people that don't visit the library frequently can still learn about those radon kits, and it directs them back to the library. And then you see this, this is a button down here at the bottom, Ask Me About Radon. I don't know if you can see in the video, but I'm wearing mine right now. Okay, and just a few more ways that we have been able to promote the program. You see we paid for billboards in each one of the communities. One of the unique things that we did, the upper left, you see, that's in Christian County. They have a transit system, which the other counties do not have. So they actually had ads placed on the transit stops there. They also have electronic billboards, I think, there, which is a little different than the other counties, which just used standard billboards. I know in Rowan County, I remember that they have a movie theater, so they were able to display some ads there in the movie theater on the screen as well. And then down at the bottom, the Kentucky Educational Television, which is our local PBS affiliate, actually reached out to us because they were doing a series on lung health in Kentucky. So they learned about the Radon and the Radar project and were excited about that, and interviewed several folks on the academic team, but they also visited our library here in Logan County and interviewed me and talked to some of the other staff and got to actually see how what the kits look like and how they're checked out. So that was a great way to spotlight our work. Okay, this is probably our most recent marketing piece that we've done. It's a series of bookmarks that the university created and distributed to each one of the project coordinators. So on the back is a consistent message about radon testing. It's easy, and these kits are available at the library at no cost. I'm encouraging folks to check those out. The bookmarks also have a QR code that takes the patron to a flyer and provides a phone number to call if they need more information. But the fronts are all different, you see that. So we have one that focuses on pets, one that focuses on family and loved ones, and then one that talks about the synergistic effects of high radon levels and smoking exposure. So these were all actually ideas that when we met with our citizen scientists, they helped us come up with. So this was a true community effort. All right, so we are currently nearing the end of our pilot phase of our program, but that's where we are right now. Our initial goal is to get 400 participants across all 4 counties, so 100 in each county, to go to the library and check out a kit, but also sign up to take part in the optional research study. And you'll see some data from that in just a moment with Stacy. So during the pilot phase, we've also had all of our libraries and our sites and the academic team have been in constant communication to discuss the successes that they've had, the challenges they faced, and the needs that they anticipate. The feedback that's received during that phase is all being tracked, of course, and that's going to really inform the changes we need to make before the launch of the full the full launch of the program coming up in December.
All right, thank you, King. So the graph that you see here is showing the library loan program radon test kit checkouts and study enrollment over time in the 4 study counties up through September of this year. So the encouraging news is that because of the kits being made available for free in the county libraries, 261 more homes in Kentucky have tested for radon that potentially had never tested before. And to me, that's a win. Of those who have enrolled in the study and reported to us their 2-week long-term average radon value, the overall average of those participants was 8.7 picocuries per liter, and that ranged from 0 to 133.4 picocuries per liter. Of the participants who reported to us, 39% of them had radon values at or above the EPA's action level of 4.0. So we have a lot of folks who are discovering that they have high radon in their homes. And the values that our study participants have reported to us will be used to improve our state radon potential maps. And these maps are used to educate the public about radon and promote home radon testing and mitigation across the state. We've also been able to provide mitigation assistance to a library loan participant, and we've referred at least 5 library patrons to the USDA Office of Rural Development for information on their 504 single family housing repair loans and grants program. By working collaboratively, we've been able to address radon health concerns and minimize disparities in testing. And the quotes that you see here about offering this free service to library patrons has resulted in greater access, and people are telling us that, no, I would have never thought to test my home if this service hadn't been provided. And I appreciate this excellent resource from my local library. So as I mentioned earlier, when employing community engaged research methods, the research team must remain flexible to meet the needs of our community partners and the community itself. And there are a few lessons learned that I'd like to point out to other academic institutions considering community engaged research. So our community partners that we subcontracted with as our site partners, like Logan County and the other AHECs and the Area Development District, they helped to lead the project in those respective counties and had to be trained on human subjects protection because they were involved in a research study and in meetings and data analysis that included participant information. So Human subjects protection training may or may not be necessary depending upon how you design your research study. An additional consideration that required flexibility from all partners was in regards to marketing. So the university has strict rules on public-facing materials that are associated with research studies and the university that we had to abide by. So for this reason, all of our public-facing materials had to go through public relations for approval before being used. And our partners were great about this, but it took some getting used to, as they were used to having much more independence with making decisions about advertising. Additionally, as is the case with community engaged research, as King described earlier, it was important for the academic team to be flexible to meet each library's needs and capacities. So while we wrote the grant and we went into this with a certain set of ideas, it was really having those planning meetings ahead of time and learning from them what they were capable of and how they normally operated that helped to really shape the design of the program. And it also, we had to remain flexible when considering the best way to get the word out to the public that the radon detectors were available for free in the library. In each of these cases, having the community insights of our citizen scientists and our community partners was so valuable. Lastly, we're learning that other libraries are interested in hosting similar radon detector loan programs and using their libraries as a hub for environmental health projects in citizen science. We have had a number of libraries in Kentucky reach out to us and ask when we're planning to expand this program to other counties. So if you are a member of an academic institution and considering citizen science, I would encourage you to consider your local libraries as a potential partner. So our next steps for this project include revising our library materials based on input from our citizen scientists and library loan program participants, and building coalitions within each of these 4 counties that will take on lung cancer prevention efforts in their county that will extend long after the funding for this project is over. We really underestimated the amount of public education and radon about radon that would be needed, and our coalitions will help us design messaging and marketing about radon that will resonate within those communities. Included in these coalitions will be efforts to address disparities in radon mitigation, making indoor air, clean indoor air available for every Kentuckian. And in closing, King and I would like to just express our gratitude to the Region 1 of the Network of the National Library of Medicine for allowing us to share our story with you today, and we'd be happy to answer any questions that you may have.
Great, thank you so much, Stacy and King. Thank you, thank you, thank you. This is very interesting. We do have a couple of questions. It's kind of one, where do you, who do you contact to test your home for radon? And I'm thinking probably, you know, if you don't have a program like this in your library.
Yeah. So there are several ways that you can get your hands on a detector or hire someone. So a lot of the times local home improvement stores have radon detectors available. They can be as little cost as about $15 for a short-term test kit, or you can purchase a long-term test kit that'll cost you about $40 or $45. In addition, if you want a test kit like the ones that we used in this program, those are a little bit more costly. It's a continuous radon monitor. You can buy those off of Amazon or directly from the company, and they cost about $140. A lot of times health departments also may have these available for free. So I would suggest if someone is interested, they could reach out to their health department and see if they're available. And that is if their state has a state radon program. So here in Kentucky, our state radon program does offer free radon test kits to the public. You can get those by contacting them directly or by contacting your local health department as well. And then there is also a website, and I'll find the link and put it in the chat box, but it's the National Radon Proficiency Professionals website. Excuse me, I know I'm not saying that correctly. It's NRPP. But if you go to that website and put your location into the search, it'll pull up a list of certified radon measurement and mitigation professionals in your area that you can contact.
Okay, great. And I just stuck that link in the chat. I think that's the correct,
Thank you.
it's nrpp.info. Okay, so how would you suggest libraries replicate replicate the program, you know, with or without partners?
Sure. Yeah, I think this the great thing about this, it's really scalable. So obviously, we had an academic partner with a grant who was able to provide funding for our staff training and of course the equipment and everything else, which is fantastic. But you can certainly scale that down for any size library or community. You could start out with one or two of these kits, really, and just see how it goes in your community, and if there's a demand for more, potentially add that. We're of course glad to talk to any library that wants to know more about the program, but there's usually someone in either an environmental health program, I would say at a local college or your local health department would be great places to get a little bit of training and background information, because you don't want to just get the kits and check them out and then because then people come back with the questions, well, what do these numbers mean? How do I interpret this? Where do I go from here if I do have a concerning level of radon in my home? So you want to have some of those steps in place. You don't want to just provide the kit, but then none of the background and the context for that information.
Okay, thank you for that. Next question is, are there any plans to seek grants to subsidize mitigation for folks who need financial assistance? Or would you just point them to the Department of Agriculture?
Yeah, thank you, Colin, for that question. So as part of this grant, we do have some funding available for to help offset the cost of mitigation. So we attempted to simulate a tax credit. So for those who qualify, because the funding is limited, we had to establish some financial qualifications. So for those who qualify, we are offering 30% off the cost of mitigation up to $600. And we have vetted radon mitigation companies in our state that will take that voucher from us, and that will, we would feel comfortable having mitigate our own home. So we do have some money available, but we do plan to extend this grant or pursue additional funding to address that problem. That's one of our partners that I mentioned earlier is the Community and Technical College. So we're trying to increase access to folks who are qualified to do this. And so we have a great partner in their construction and technology group who's interested in adding this training into their curriculum for those who are going into the housing industry. So they have the skills and the knowledge set when they get out and are starting to do this work. They're qualified to do so. And because we have the community and technical college system across the state, we think that'll really be a wonderful partnership to grow access to folks who can do this sort of work. But it's going to take even more than that, right? We're also, another part of our Breathe program is through advocacy and policy change. So we're really trying to raise awareness about this need. We're going out and talking with any sort of organization in affordable housing that is willing to listen to us, so we can talk about radon being a hazard in the home, and it deserves to be addressed. And folks that can't afford to be fixed are really facing an environmental injustice that we need to help so that they're also having the access to clean indoor air. So policy change is one that, you know, we're working towards, and that takes time, but it's going to take some sort of policy change. And there are other states out there like Colorado who have this pool of money that folks of low income can apply for to offset the cost of mitigation in their home. But that's something that, you know, we're hoping to replicate in the future in Kentucky, but it'll take some time.
Something I thought was really interesting, if I may add this, is so in Logan County, we're slightly ahead of the curve maybe with getting our Radon Coalition started. We had a local health coalition who was glad to partner with us on this. I know one of the really neat ideas when we went to them and talked to them about this issue, and we talked about the steps of mitigation, one of the things that came up with, it's a lot cheaper to put this equipment in your home when you're building a home rather than retrofitting. As you can imagine with anything with a home, right? It's cheaper to do it up front. So they were really interested in being proactive and talking to home builders associations, that sort of thing, and encouraging them to, since we do live in an area with really high radon levels, to encourage folks to go ahead and just put this equipment in, assume it's going to be an issue, and then afterwards you can test to ensure that it's working properly and that your home is safe.
That's great.
I have another question. As far as the, you know, looking at it, the health departments that may have detectors, what would you suggest kind of searching for to find that? Is it just a matter of, you know, putting in radon detectors, you know, my state, or, you know, my health department?
So the money would come from the EPA, and they end up contracting with the state. So it's probably the best place to probably start is through the state's Department for Public Health. So that's where our the program for Kentucky has been for years, and where you would likely find information in other states about their state radon program as well. I'm not sure of a website that would list them all, but I can look for one and send that to April if I can find one.
Thank you.
Yeah.
Hey, do we have any more questions? All right, it looks like we do not. And Christine, if you can stick the evaluation link in the chat. Yes, thank you. So thank you very much, Stacy and King, for your presentation. This has been great. And you know, I was collecting links as you were talking as well. So any links that you come up with and want to share with me, I can put them into a document and put them on the class page.
Okay.
So thank you for that. And yeah, please fill out the evaluation. We want to know what you think, and you can get your CEs. And with that, thank you so much to our presenters, and everyone have a fabulous afternoon.
Thank you.
You.
Thank you. Bye-bye.